This is to report about the topic competency-based education, current trends and issues in nursing education. When we hear the word competence, we use different definitions of it, such as the ability to perform at a desired level according to a certain standard, and which this refers to competence output. Example, ability to perform in work roles or jobs to the standard required employed. Another is the ability to choose and use the attributes of knowledge, skills, and attitudes. This is the performance at a desired level. This involves metacognitive attributes. Like for example, competent person is within a certain context or situation, able or capable to choose from a situation of available behaviors and to execute suitable behaviors in order to reach a certain goal. Also, competence is a mere description of what someone can do or a person can able to demonstrate. This is where competency speaks about the capability to choose and use or apply. In the current situation, education, particularly professional, technical, vocational education, is always facing the problem that knowledge acquisition does not necessarily mean the successful application of the same knowledge. That's why the need for competency-based education has been recognized for years. The preparation of graduates for a wide range of professions and trades has been a concern of employers. Education and work were disconnected, and new graduates did not have the basic skills to function in the workplace. Also, students were weak in universal skills such as reading, writing, oral communication, mathematical computations, creative thinking, problem solving, managing self, working with groups, and working effectively within an organization. There's a quite revolution at work in education that started over 25 years ago. New directions for learning are being advocated in all levels and types of education. Additionally, graduates needed specific entry-level skills to function in their specific disciplines. The health-related profession requires demonstrated competency in their practitioners. New graduates need to function at a specific required level to provide specific care. Continuing competency is also required to ensure that expert quality care is being provided. That's why leaders in medical education programs have been at the forefront of implementing CBE approaches. Also with this, institution faces different situations, like increasing amounts of information, introduction of new technologies, decreasing fund, and there are external demands for accountability. Also competency-based focus on all different types of education, like what we are facing today or what we are applying currently, the K-12. Also CBE is applicable in undergraduate, graduate education, continuing education and training in the workplace, like trainings and programs in the hospitals or educational institutions, and patient and consumer programs. There are a lot of reasons for the current interest in this type of education. One is educational institutions and providers need evidence that anyone who completes a degree or course has achieved a required level of competency. Another one is that accrediting regulatory and professional groups want assurance that completion of an educational endeavor indicates competency. Also, there is a greater accountability for the cost and time it takes to complete educational endeavors and determine if they achieve the expected outcomes. Also, employers hire new workers who do not have basic competencies required for entry-level positions. This is just to fulfill the vacancy of the job. Another is that employers invest in extensive training programs, different training programs to address the initial needs of new employees and continuing training needs of all employees, especially those in complex changing work environments. This may be costly or expensive to other employers, but it will suffice them, a competent employer for their workplace. Another reason is that regulatory, legal, external standards and quality measures require demonstration of competence. And workers need to continue their own personal and professional development to advance their careers and make positive contributions to their specific organizations. Another theory of Gongzi, or another study of Gongzi, described three ways of conceptualizing competence. It is valuable to realize that there are different approaches to conceptualizing competence. This is important as institutions start to implement competency-based education curricula because the mission, philosophy, and goals of the entities need to be met. And the following are: 1. A behaviorist or task-specific approach that is assessed by observation or performance for evidence. 2. An attribute or generic skills approach and general attributes are crucial to effective performance based on general competencies already learned. And the third is that an integrated or task attribute approach must be used. Another persons involved in CBE is that Dusavisien and Lepay proposed a multidisciplinary approach to the conceptualization of competence. They have viewed performance as having different hierarchical levels that require different levels of competence. If you are in the first level, this describes that behavior competencies relate to operational work performance and have to meet the demands of the workplace. Also, they have clearly stated constituent parts consisting of competencies. For the second level, additional competency based on behavior and additional knowledge needed to improve your work. Advancing to the next level, level 3, integrated competencies that support change of internal and external working conditions, knowledge, skills, and understanding are integrated into internal and external work conditions. And for their highest level, which is level 4, this involves holistic competencies necessary to develop new work and transfer knowledge and skills to new situations. Nagle-Smith in 1995 also describes the basis of professional competencies, a set of essential relevant knowledge, skills, and attributes, and attitudes rather. There are different elements needed to achieve competency. One is that the determination of knowledge, skills, and abilities required for graduates of nursing education programs based on standards and legal requirements. 2. Relevance to current practice. Also, registration and licensing examinations by boards of nursing or other boards of healthcare practitioners. Lastly, Board of Nursing Continuing Education requirements for licensing. These are the different elements needed to achieve competency. Another reasons or different elements to achieve competency by Nagel-Smith are employer monitoring of required staff development modules, completion of courses, demonstrations, and examinations. Also, we have certification requirements by professional nursing organizations issued by our PRC. Also, standards and accreditation for nursing practice guidelines. For CBE, we also have differing views or opinions by other educational authority. The other opponents of CBE, primarily in higher education, raised the following issues for not implementing change. One is that general resistance to change in colleges and universities. Also, for them not to implement change is that higher education should not be totally aligned with employer and other external stakeholders' demands. They also view CBE as being useful primarily in vocational or technical education settings per se. We also point out that applying CBE to general and liberal education is reductionist and just prescriptive. Also, the faculty currently determines assessment based on professional judgment, and CBE shifts this process to include others. This is in reference with Voorhees in 2001. Also, lack of emphasis in CBE in programs that prepare the educators. And lastly, the need to train educators to reorganize curricula are the reasons why they do not implement CBE. If they have the reasons of not implementing CBE, you also have the reasons for redesigning programs or curricula or courses to align with CBE. One is that continued competence of nurses and other health professionals is not required after initial licensure or is assumed based on completion of various educational programs. In reality also, educational programs for nurses, health professionals, patients, and consumers may not stay current with new knowledge standards and regulations. That's why we need to keep abreast. Also, traditional programs focus on content from textbooks, articles, commercial education materials, and other sources, which may not be current. Materials used for consumer education may not address key areas such as literacy levels and the needs of multicultural and diverse populations. Changes in regulation standards, best practices, and new evidence all contribute to the need to revise educational offerings. Why? The continual revision of educational programs, based solely on updating content, is impossible to manage and does not address learner outcomes that demonstrate the achievement of the competence. That's why we all have these reasons to apply or redesign programs, curricula, or courses for the benefit of our graduates. In terms of health trends in nursing, competency-based nursing education is the kind of healthcare education which is based on the assessment of the needs of the profession. The competencies required by the healthcare professionals in the modern world, where healthcare needs to continue, change constantly, are derived from the roles of the various people involved in healthcare. The education is based on the techniques that will help instill and improve these competencies in the graduates. The following examples demonstrate different approaches in implementing CBE based on identified needs. One is that WHO in 2007 recognized its efforts on many fronts to improve the health of all people. We have strategic directions that were developed from 2000 to 2008 and included five key intervention areas to improve nursing and midwifery services. And these keys focuses on one, health and human resources planning, two, management of health personnel, three, practice and health systems improvement, four, education of nurses and midwives, fifth, leadership and governance. Those are the five key intervention areas to improve nursing and midwifery services. Another example, other than WHO, is the specific guidelines for implementing the strategic directions for strengthening nursing and midwifery services in the African region that were developed for 2007 to 2017. Here in the Philippines, we also have our curricular programs or changes in the course per se, initiated by our CHED, Commission on Higher Education. They've released CHED Memorandum Orders Series of 2008, CMO5, and revised for CMO 14 Series of 2009, which speaks about the policies and standards for Bachelor of Science in Nursing program. This aims to develop a more competent and globalized curricula for nursing education. In summary, CBE addresses the need to have graduates of nursing and health-related programs prepared for entry-level positions in their practice areas. Educators, employers, students, consumers, and external stakeholders all can contribute to making this a reality. Having a clear understanding of CBE is the first step in making a decision to implement competency-based education. The implementation of CBE requires a change in philosophy. Essential competencies based on current standards and evidence are established. Developing valid and reliable assessments to demonstrate what graduates know and can do is the key to assure competence. And that's the end of my report. Thank you for listening.